Health insurance has become extremely complex.
It's really hard to navigate at times, especially when we get our first jobs and we have to go through the process of, okay, which insurance do you want for your health plan?
It can be pretty confusing because when you're looking through all the different plans, there's a lot of different phrases and terms that require a little bit of research if you're not familiar with them, but they're really important to understand because they can make the biggest difference in what you're actually covered in.
So what are the questions you should ask when you're looking at a health plan? What are my monthly premiums, copays, and deductibles? Do I have to meet the deductible before my diabetes medications, supplies, and services are covered? Every plan has a deductible, so you need a deductible you can afford. If you have diabetes, never buy a high deductible health plan. That way you spread that cost over a monthly basis instead of having that big bill at the front. A high deductible plan essentially just means before your health plan kicks in, your share of what you have to pay for your health care is very high. It's not $500, it's $5,000. So you have to pay all the bills for all of your health needs until you hit that deductible. Copays versus coinsurance. Coinsurance means that you're paying a percentage and your health company's paying a percentage until you hit a threshold. A copay means that every time you go to the doctor, you pay $100. Or every time you pick up a vial of insulin, you pay $25, $50, $100.
So finding a doctor who's willing to fight for you and is willing to, write those prior authorizations and be your advocate to the insurance companies is going to make a huge difference.
Don't wait till you're a senior in college and then you have to figure everything out, because not only do you have to figure the job stuff out, but you also have to figure out your medical stuff. So you won't financially be like, oh my gosh, I can't pay this.
And then you've got all these wonderful little acronyms. HDHP, PPO, EPO, HMO, FFS, Medicare, Medicaid. Medicare, of course, is for age 65 and older. And Medicaid is either low cost or free health insurance, but it sometimes can be very limited on the scope of what it covers. And it is for people that meet the threshold of poverty earnings, which sometimes kids coming out of school meet that threshold.
I was 20 when I got diagnosed with type 1 diabetes and was lucky enough to have, great parental support. When I turned 26, I was, of course, kicked off of their insurance. Through the Utah Medicaid, I was able to get supplies for my pump. But for some reason, Dexcom wasn't covered. It varies state by state. When I moved to New York, I applied for New York Medicaid and was able to get accepted, luckily. Here in New York, they cover everything. It's incredible.
You can take the answers that you get from the experts and the answers you get from your friends and your family, and you put them together and you put the pieces together. There's more than one avenue to get to the answer you need.
I kind of narrowed my options down to 2 or 3 plans. And what it actually came down to was just figuring out which silver, gold, or bronze plan worked best and which made the most sense. I took into consideration how many doctor's visits I'll need a year, so how many endocrinologist appointments, how many specialty appointments with other doctors, whether it's a copay or co-insurance, which made more sense, and laying it out for the year and basically based on my usage. For me personally, having the higher copay with the lower deductible made sense for that just in case scenario, and that's kind of how I made my decision.
In the end, we want to be able to not only live with this disease, but I think thrive with it and be able to be successful in our lives and live as close to normal as we can.
Keep asking questions, keep being persistent, so the health insurance that you need, and so you can still manage your diabetes to the best of your ability.